Good afternoon. My name is Peggy D'Adamo, and I work for USAID's Global Health Bureau here in Washington. I'm the Knowledge Management Advisor to the Office of Population and Reproductive Health, and I'm actually the only person in the Global Health Bureau who focuses on knowledge management. So it's quite a big job. Before I came to work here at USAID, I did a lot of work helping to create and support communities of practice and helping identify evidence-based best practices and finding creative ways of sharing and getting people to adapt them. And that's also part of my job here at USAID. When I found out about the KM Impact Challenge, I was really excited to learn that people working in other bureaus at USAID and their partners were just as interested as I am in figuring out how to measure the impact of investing in knowledge management and in demonstrating that knowledge management is really a key element of effective programming. You can't do without it. I was also excited to see that the challenge was trying to get participation from many sectors beyond health, like agriculture, environment, gender, and microfinance. I think we all have a lot to learn from each other. Over the past couple of years, I've been working with representatives from all the partners that work with the Global Health Bureau and the World Health Organization to create a knowledge management working group that would focus on reproductive health. And there's a tremendous amount of interest and creativity in that group. In family planning, we have the same issues and concerns that you have who work in other areas. How to convince our project managers and our organization CEOs that KM really needs to be an element of every project. How to measure the return on our investment in knowledge management, and how to create a culture of sharing within our organizations and between partners, which is quite a challenge. We also want to know more about how to synthesize and share knowledge and information in easy-to-use ways, and how to measure the impact that that knowledge sharing has on projects and programs. In the health sector, we believe that it's important to make sure that health workers at all levels are able to access, adapt, create, and share information and knowledge, and also their expertise and their experiences in ways that are easy for them to do, whether it's in a meeting like this, a training session, a webinar, through a community of practice or an online community, in a publication, or even through mobile technology. Knowledge exchange is really key to improving the quality of services, which will contribute to increased uptake of services, and we think that will lead to improved health outcomes. We have a lot of challenges, we know that. How to get programs to implement the best clinical practices that have been identified through research is challenging. You would think it would be easy, but it's not. How to scale up successful pilot activities more quickly, economically, and effectively. How to support creative ways for sharing tacit and experiential knowledge more effectively. And one of our main challenges has been to adequately measure how sharing knowledge contributes to improving health programming and health services in a convincing way so that we are able to support continued funding for KM activities across the Global Health Bureau. I feel that our partners can learn a lot and contribute a lot to this challenge, and I've encouraged many of them to develop and submit their own case studies, and you will hear from some of them at the conference. It was a pleasure and an honor for me to participate in the peer review process. I reviewed 10 of the case studies that were submitted to the Impact Challenge. As you know, we ranked them according to clarity, analysis, creativity, and replicability. And we organized a great discussion after the ranking process among the technical group members, where we talked about some of the kind of pitfalls that we experienced trying to do the ranking. I would really encourage all of you to take a good look at the case study synthesis report. I think it makes some excellent points about the pros and cons of collecting data, whether you're interviewing people or using surveys, about keeping monitoring systems simple and not measuring what you don't intend to actually look at, and about how monitoring systems really have to be built into a project at the very beginning, at the planning stage. They can't be an afterthought. It also talks about developing actionable indicators, which is something we've been thinking about for quite some time in global health. I'm excited about the potential of this conference to move us even farther along in our discussion of how to more effectively measure knowledge management. And I think it comes at a good time for USAID as an agency and for our partners. We have a new focus on evaluation at the agency, which stresses the same lessons and principles that were addressed in the case study synthesis, and which I'm sure we will be discussing today and tomorrow. And at least for some of us working in global health, the unconference also comes at a time when we are challenged to work smarter, to collaborate across agencies more effectively, to integrate our programming, and to scale up innovative health programming more efficiently and quickly. I look forward to discussing these issues and other issues with all of you at the conference, during the webinar, and afterwards online. Thank you very much.